Confused about the differences between home care and home health? These are some of the things we're going to be talking about. Hi, my name is Steve Cohn with Medical Consulting and Management. The first key difference is how it's paid for. So home health is typically paid for by insurance, such as Medicare, or in some cases, Blue Cross Blue Shield. Medicare Advantage sometimes will pay for that. Whereas home care is usually private pay. It's paid for out of your pocket, or if you happen to have purchased one of the premium policies called long-term care insurance. So long-term care insurance is the only insurance that will cover the care of home care, whereas regular insurance or Medicare will cover the cost of home health. For veterans, for example, there are pots of money set aside for veterans that might be able to help you in a home care situation so that you don't have to pay out of pocket. There's something called aid and attendance, which is a pot of money set aside for veterans based on the level of service that they've provided to the country. This level of service can be found out simply by calling the VA. They're very good when you call the 800 number just to call and ask, what is my level of service? They'll run you through a series of questions. They'll look up your account. And this way you'll find out what you might qualify for in terms of aid and attendance benefit. The VA also has different vendors set up who can handle direct care, direct home care covered by the VA. This is also helpful for veterans and something that the veteran should be looking into. Another key difference are the services that are offered between the two different types of care that we're talking about. So, for example, home health typically provides skilled types of care. For example, physical therapy, occupational therapy, speech language therapy sometimes, skilled nursing, wound care. These are the kinds of things that are covered by insurance and are typically worked under through home health. Now, home care is what they call non-skilled, even though, again, as I said, there are skills involved, but they're usually handling things like activities of daily living, how to get help with getting dressed, preparing a meal, helping with showering, getting to and from the bathroom, things like this. These are some of the things that are covered under home care that are not covered by insurance except for long-term care insurance. Another of the differences to discuss when talking about home care versus home health are the amount of care that you'll receive or the number of hours of care that you'll receive. Typically with home health, there's a certain number of visits per week or per visit or hours per visit that are covered by insurance. And they're strictly regulated mostly by Medicare. So if you had physical therapy, as an example, they typically only allow 2 visits per week, sometimes 3 in unique cases, but it's 2 visits from a physical therapist per week. Whereas home care, those hours range anywhere from mostly 4 hours a day all the way up to 24 hours a day, 7 days a week. So you can get as much home care as you can pay for or as you can afford out of pocket or through your long-term care insurance. So those are the 2 primary differences between the amount of time the care is offered. One of the things that's really nice about home care versus home health is that they're often used together. They tie in together very nicely when a family has home care in place at home, for example. Let's say, for example, someone's discharged from the hospital and they're given a certain amount of physical therapy to do at home, a certain amount of occupational therapy. If they have home care in place with a dedicated aide who's working with them, the aide can sit and observe and watch what the exercises are with a physical therapist. And then on the off days when the therapist is not there, they can run through those exercises with the client to help them get the exercise that they need on the off days, since the insurance from Medicare or the other insurance will not necessarily pay for additional visits. This is one of the benefits of home care and home health working together. The outcomes are usually much greater when there is home care in place and there's a home health situation involved. Another example would be if there is a wound. We see lots of wounds for many different reasons. Let's say they happen to be receiving a wound on their backside from sitting in bed too long or something like that. Having home care in place from a private aide is eyes and ears. So the eyes can be looking at and keeping track of what's going on with a particular wound. And then when home health comes in, they can communicate nicely with the home care aide and help get the care that's needed to help that wound get healed. This is another just example of some of the ways that home care and home health work together. We work very closely with home health providers in our area. So if you need assistance with that, let us know. We'd be happy to put you in touch with home health agencies. And in addition, we're in touch with primary care providers who work in the home and are covered by Medicare insurance or other insurances. So just let us know. We'll be happy to put you in touch with them. If you'd like more information about working with medical consulting and management, please check out our website at mcmhomehealth.com. Thank you.